Researchers in different parts of the world, including Rwanda, are doing their best to come up with a cure or vaccine for COVID-19. And some of them have said that finding a cure and vaccine for such pandemics requires a lot of time, 2 to 10 years, as explained by Professor Leon Mutesa.
That we need a follow-up to evaluate the side effects. That follow-up can take up to from 6 months up to 1 year before you get that result. And some scientists, they're trying just to be very faster, depending maybe on what they are using, the tools they are using. So, but most of the time, discovering, for example, a vaccine, it takes up to 2 years, because you just start by animal models, and then after that takes time, and then after that you go to the humans just to test and to use your discovered vaccine or drugs. That already it takes time.
Professor Leon Mutesa has also said that hydroxychloroquine that used to treat malaria is now being focused on by researchers all over the world, including Rwandan researchers, for the treatment of COVID-19. Though in Rwanda, no cases have yet needed such an approach. Professor Leon Mutesa says that the local research known as pooling is being used in testing COVID-19.
Today we are really proud to say that we have discovered an approach called pooling approach for testing patient with COVID-19 infection. So this pooling approach is application of a mathematical model and laboratory biological models, where we see that the virus has what we call genetic material. That genetic material, that is the one we see when we test. And then what we do, we just make a group of pools. We put 2020, so for your sample size of 1,000, you just get only 50 pools that to test, which means instead of testing 1,000 samples, you will only test 50. And then for those 50, you can just give results. If by testing so, by doing so, you have one pool which is positive, and then you go back, you go to test one by one, and then we minimize the cost.
The Director of Medical Research Center at Rwanda Biomedical Center, Clarissa Musanabaganwa, has shown that there is research that is being conducted to further boost the health sector.
One of them is to understand genomic characterization of COVID-19 in Rwanda patients. This research is going to help to understand transmission chain of COVID-19 in Rwanda, and also give some important biomarkers and highlights on the other that may help to shape other research that aims to develop vaccines that may be helping in the future for COVID-19. Another important research that we are conducting is the one that seeks to understand community dynamics and response to COVID-19 infection within Rwandan patients. This research is going to inform policymakers on the status of immunity response of patients who have been infected by COVID-19 in the country.
Currently, the total cases for coronavirus in Rwanda are more than 460, with around 300 recoveries and more than 160 active cases.